Hello everyone, I'm Todd McCluskey, acupuncturist in Washington, D.C., and today's video is Stomach 40. Stomach 40 is a special point in my life because of a couple reasons. One, it is a workhorse. I use this point frequently, especially during allergy season. Now I'm shooting this, I barely have any idea of what day of the week it is or what day it is. It's in the middle of the coronavirus. But I do know it's in April, and allergies have been rip-roaring around. And if I was in clinic right now, I'd be using this point multiple times a day on that yucky, drippy, congested allergies. And we'll look at that down the road in the video. It's also really a special video or special point for me because it is a point where I first stumbled upon depth and the importance of depth in needling. And it was purely by accident. As I was working, I hit the channel and I did something else, slightly different depth. I'll tell the story later on. And bam, like a little miracle happened on the table. And it really kind of stuck with me. In your clinical practice, I'm sure there's going to be points where you're like, oh, I remember the time where I used the point and I got it to work this way for the first time. And it sort of sticks with you. Well, Stomach 40, Abundant Splendor, has one of those stories for me. All right, now contextually, we're in the middle of coronavirus, things are nuts. I've been basically at home. I don't know if it's been 4 weeks or 3 weeks. It's all kind of blurring together. Trying to muddle through all of this. So eating really well, getting some nice little light exercise in. I'm gonna be doing some home projects, which is nice to do, kind of knock some of those things out. And of course, make these videos. So this video, I'm going to start by looking at generalized usages of this point, particularly what I don't use it for. Doesn't mean it's not good for these things. They're probably fantastic for these other ideas. And as a matter of fact, when I did research for this video, a lot of these other usages, I'm going to bring and pull into my practice and try them out and see if I can get them to work. So we're going to go over a general look at Stomach 40. Then specifically, we're going to look at the indications, how I use them. So what are the indications in my practice that I draw upon to use this point? And that's the most important part of this video, because this video is about what do I do in my practice, not what could be done for Stomach 40. What do I do in my practice? And specifically, how do I needle and find the point to do that? Because this is not some sort of, acupuncture isn't a magical process of deep self-cultivation in which only you will have a special relationship to the acupuncture point. No. There's much more of a technical skill that needs to be understood. And if I can make an acupuncture point do something, then you should be able to make that acupuncture point do exactly that same thing. It might take a little skill, it might take some practice. Like I said in the Stomach 36 video, it took me like 2 years to really get Stomach 36. Hopefully for you, looking at that video, it will only take you 2 months. That would be the hope of anyone teaching, is that the people listening, the students or whatever, that they will go quicker than the teacher. So this is my attempt to give you my learning so that you can move more quickly and learn things that took me, well, too long to learn. Anyway, we're gonna go through general indications. Specifically, what do I use this for? How do I locate and needle it? And then the effects you're going to want to see. And that should be a good wrap up of this video. Now, going to general usages. I went through and I just blasted through like a bunch of my different acupuncture books around here. And I want to give a particular shout out to the Classic of Sporting Life Acupuncture Moxibustion, translated by Lorraine Wilcox. Awesome. Not only is she a badass cross-stitcher, but she does one heck of a job at translating. So if you don't have this book or the different volumes of it, please get it. This has been a great book to look at, as well as, of course, Deadman and some others. I really like the Applied Channel Theory from Wang Ju Yi, so that's pretty cool too. Gives me a good starting point to go from there. Anyway, going back to some of the general indications that you'll find for Stomach 40, I'm going to talk about it from a dimension of phlegm and dampness. but you'll find that this is a point that governs dampness in the body and things like that. And there's all different ways and all different kinds of dampness it'll govern. It seems to govern, if you read into this, it seems to govern, say, pitting edema, where let's say you press in to the skin, but it doesn't rise back up. So things like that, for instance, but we'll get to that in a little bit any which way, so I'm not going to get on that too much here. One interesting thing that I found looking around at Stomach 40 is that it is very useful for counterflow chi. I don't use it for counterflow chi. Like, I can't remember the last time I specifically chose this point for counterflow chi. I don't know if I ever did. But you'll find a huge number of references for counterflow chi right here. So it's definitely worth looking at. So when I get back, my practices open up, all that again, what am I going to do? Stomach 40, counterflow chi. I don't do it right now, but that's something I'm going to use in the future. Other interesting indications that I don't particularly use it for, and you might not in your practice, would be chest pain. And they'll also say in some of the references, cutting pain in the abdomen. It's interesting that it's not translated as stabbing pain. I wonder if it would be the same word. It's cutting pain in the abdomen. Or in this case, for Stomach 40, you'll see it for chest pain. So the thought, and I think this actually comes out of Deadman a little bit, the thought from Deadman would be, well, this is the sinew channel it's referring to. And that when you're needling Stomach 40, you can access the sinew channel, which I believe you can. And I'll talk about that down the road. And I'll give you my ideas on maybe how you want to needle chest pain. It would be just musings, because I don't use it for chest pain, from a sinew perspective. So the thought is that the stomach sinew comes up, or does come up, and it binds in this area here, and therefore it can be very useful for chest pain. We also know that one of the empirical points for shoulder pain would be stomach 39, which is like right next door. It's just a little bit medial to stomach 40, and that governs or does a lot for shoulder pain. I don't particularly use that in my practice because when I'm treating somebody's shoulder, I find that's generally a very complicated thing, and I don't believe that one point's going to do the trick. That being said, probably in my first year of practice, I still remember a time in which the first time I tried this, I had somebody sitting on a table and I was needling stomach 39, having them roll their shoulder around, and my God, that pain went away. I want to say it wasn't like a one and done treatment in any way. I can't recall any other details because this is like going back, I think 10 years now, something like that. But, I find that when somebody really injures their shoulder, generally speaking, you want to look at the complex of it. So I don't really rely on one distal point. I might put it in at the end after I've done all my Assure work. But that just kind of links in a little bit with chest pain. So I will definitely pull out stomach 40 for chest pain in the future. Easy to remember, put it in my back pocket, pull it out, see what I get. The other indication that I found, which is pretty cool, and this is actually one that I find other people use quite a lot, is that if you look at Ling Shu chapter 10. So in Ling Shu chapter 10, I'm not an expert on the classics or anything like that, so please don't rely upon me for all of that. But if you read Ling Shu chapter 10, awesome. First of all, you gotta go out there, read your chapter 10, read it about a dozen times. It's gonna be worthwhile for a number of reasons. It starts by going through the trajectories of the conduits. So these are the channels. And I'm not going to get on a soapbox right now. I said I'm not going to do this. So I'm not. I'm going to allude to it. I think I really will need to make a video one day on this, standing on a soapbox video about acupuncture charts and how they just rock the mind of the young acupuncturist. And that we just need to do away with them. Now, we're not going to do away with acupuncture charts. They are important, but it's good to understand how the acupuncture chart actually skews the way you look at acupuncture, the way you select acupuncture points, and the way you understand the flow of the meridian, the flow of the channel, the trajectories of the channel through the body, because it totally skews. It also skews it puts a kind of a filter in between you and the reality of your patient. Now, I won't go into all of those details now by any means, but if you read chapter 10 of the Ling Shu, what you'll see is they'll seamlessly describe the flow of a channel from the exterior to the interior. Huge. And we miss that constantly on charts. So that's my little tangent for this video. Anyway, read chapter 10 and just let it sink in and kind of blow your mind a little bit. It's totally worth it. But in chapter 10, they go through the conduits. So they say, okay, this is what the trajectory of the conduits. And this is the language of Unschuld, the conduits. And this is the trajectory. Then it goes into, okay, well, this is what happens when you have a problem in the conduits. And then they go for each one, the Taiyang, Yangming, Xiaoyang, all that sort of stuff. They go through, okay, here's the problem, this is what happens, and here's what it could look like. And then they go through the pulse to determine if it's sort of like what we call excess or deficiency. They go through all of that. And then they go into describing the network vessels. So get it? So conduits, this is how they flow. Here's the problems that can happen in them. Network vessels, right? The low channels, and then low points, right? So obviously if we cut across this, they're describing Yangming channel, foot Yangming, the problems in foot Yangming, the low or the network vessels of foot Yangming, and then abundant splendor, stomach 40, boom, cut across there. The implication would be you can use stomach 40 to go over here and treat the problems that arise in the vessels, right? That would be the thought. So when I'm talking about abundant splendor, when I'm talking about stomach 40, I really need to also pull apart that and look at, well, what does the classic say about it? And they'll talk about a very interesting situation where obviously if you're reading about Yangming, foot Yangming, there's going to be a lot of like digestive trouble. But what you see a ton of is, and I'm reticent to say psychological. I mean, I'll say it just for ease, but it just doesn't seem right to say psychological trouble. You'll see a lot of psychological trouble. So you'll see a description of a person who might be withdrawn, kind of curled up a little bit. They're going to be quiet. They don't want to speak. They'll be inward. They don't want to go out and leave their house. And then you'll hear a description. The next line is like, oh, or the person's going to sing. They're going to want to dance. They're going to want to take off all their clothes and climb up to like the highest point. Things like this. Now, I don't see that too much in my practice. I know some people who do. So I have not had to deal with that degree of psychological trouble, at least not actively with the patient. I mean, I could have probably used this back in college, quite frankly. There has been probably a time when, dancing and being naked and, climbing up trees and things like that. Anyway, there's, in everyone's life, there are things that we've done in the past and we just have to learn from, digest, process, and move forward from. Anyway, so all that being said is probably that'd be very useful in college and in some people's practices today. I jest. But what people will look at, they'll take that and they'll say, oh, well, if you bleed stomach 40, you're going to be able to treat a lot of, whether it be mania or perhaps other psychological or emotional troubles. You particularly see this, I've seen this with a lot of people that have studied with Jeffrey Yuen, and they've looked at his channel systems. I've heard it from a number of people where they come back and they'll say, oh yes, bleed stomach 40 for this or this. And it's always some sort of very pent up emotional component. At least that's what I've heard people talk about. I'm sure they'll use it for a wider range of things, but just kind of being around, chit-chatting with people, that's one of the things I hear. So people use it for psychological, emotional. Settling the Shen is kind of what it ends up being translated in say, Deadman. So you might not want to, I feel like settling the Shen just doesn't really capture somebody who's stark raving mad, stripping off their clothes, climbing a tree. But, potatoes. I have in my practice used it for settling the Shen, kind of psychological components like that, but not a whole lot. It's not my heavy hitter, and I've not found it to be like a miraculous point for that, but I don't really bleed points. So it might just be I'm not picking the right patient, and maybe my patient selection isn't fit for it, or it could simply be I'm not using the right technique. I should be bleeding the point and then I'll get miraculous results. So anyway, it's worth keeping in my back pocket and maybe thinking about this for the future, but certainly if I do get somebody who is in this sort of bipolar manic state or even a depressed state, I'm going to consider that next time. All right, so those are general indications. This is what you can do. So if you pick up a book like this, read through it, awesome, highly recommend again. You know, pick up your Deadman, take a look at it, whatever book you like to use. You'll find a lot of these in there. Now, I am not a master of acupuncture where I can tell you exactly how to get each point to do each thing from my own clinical experience. Now, one day I hope to be able to do quite a lot of this. What this video is about the few things that I know how to do and a few things that I can give you so you can take back to your clinic and do exactly what I do. Not because what I'm doing is better, but because it can allow you to expand your repertoire. So, Stomach 40. What do I use it for? I use Stomach 40 particularly for two main things. One, draining damp from the sinuses, and specifically up here in the cheeks. You'll see references to plum pit chi kind of going back to going back to counterflow chi. You'll find definitely references to plum pit chi in the throat. I don't find it to be all that effective for plum pit chi. Maybe I'm just getting the wrong plum pit chi, you know. Maybe I need one that's a little bit more stomach oriented. I use kidney 6 for that, and it's like bam. Like again, it's like pouring hot water over snow, and just like kidney 6 melts plum pit chi in the throat. You know, that's for me. That's my relationship with that point. But for Stomach 40, what I do for the face, particularly congestion in here, 1. And it works amazingly well and very, very fast. 2, and I'm going to separate this out a little bit, pressure in the cheeks. And I'm separating that out because I'll use a different depth for pressure as I will for congestion. So those are 2. And then 3, headaches. And of course you can use it for a yang ming in the front headache. I don't think I get a whole lot of success for forehead headaches from it, like a yang ming forehead, but definitely in the cheeks when you get that kind of a headache in here, especially pressure-based headaches. Boom, this works really well. But I'm also going to talk about how to needle it to go more into the Xiaoyang region. And this is also an interesting point to bring up that because it's playing with the channel in a way that is more like surfing the body than looking at it as going back. It's not like looking at an acupuncture chart and saying, well, there's this line that goes up there, and if you're off the line, of course, you know, you're off the path and it's not going to affect it or anything like that. No. Totally false way of looking at the body. And it brings in a kind of an engagement, a real life engagement, a visceral 4-dimensional look, excuse me, at the channels. So that's why it's also an interesting point for that. Okay, so congestion, pressure, and headache. How do I needle it? So I'll go and tell a story about the depth, and that'll cover 2 of these. So I started using this point to open up sinuses in what would be considered a miraculous way years ago. And what I would do is I'd needle Stomach 40 and just, you know, find it however you find it. For me, I take the lazy way to find points. I don't know what you do. Like, I know there are like people from my tradition that even if they've been in practice 20 years, they'll take out those ACI rulers and boom, and they get the exact measurement, or people still do like all the finger, you know, gang signs to get like, you know, where they are, and then boom, boom, boom. For me, all I do is I go, I find Stomach 39. It's always there halfway on the shin. It's like just there. It's like was it Maryland House on 95, you know, when you're driving down 95, Maryland House is always there. There's a big gas crab and you can go in there, do your rest stop. It's always there, always open. Bing, right down there. And then I go over, boop, one little bit, and it's right there. It seems to never fail me doing it that way. But you find it however you want. Then when I'm needling stomach 40, the question is, how deep do you go? To really reliably open up the sinuses, I actually go quite deep. What is quite deep? I think 20 to 30 millimeters. Now you might not think that's quite all that deep. So I will often use a 40 millimeter needle for this, just in case I need the extra length. And in terms of the gauge, I can get away with a 0.30 gauge needle. I don't know if you can get away with lighter. Get away with a 0.30 gauge needle and I'll get out a DBC and use that. Or sometimes if I really want to get it, I'll use an EACU needle and I'll go with a 0.40 gauge. But you can use a 0.30. And that falls within the category of kind of like a regular needle. It used to be on Golden Needle's website, when you looked at their acupuncture needles, they'd have a category of extra thick. And the extra thick would have 0.35 needles, 0.40 needles, and then they would carry up to 0.60 needles in terms of gauge. I don't think you really need 0.60 needles on any regular basis in your practice. Maybe somebody does, and they can tell me when you really want to use those. But anyway, I won't go into the gauge of needles really today. So 0.30 needle, it works always in my book. If you want a little more command over your chi, 0.40 needles, awesome. Now, this is the thing. I always go off a feel for this. So it's not like getting to a depth. It's like getting to the depth of the person. And you will know when you get to the depth of the person because you will hit a thickness. So you're going to go through the tissue, you're going to go through the channel, and then you're going to hit this thickness. Now you're in a deeper part of the channel. Now you're in like a meat. There's more blood there. You can just tell it's thicker. There's more blood. There's more juice there. Once you get there, boom, you grab it. Now, needle technique. With this point, I'm always thinking of it as a kind of opening up and relaxing. So what I do is I will almost always advance just a little bit more, grasp the chi, my little J hook, and then pull, pull, pull. I'll do like a kind of a cooling sky. Now, could you do a burning mountain there? I'm sure, but for some reason it doesn't feel right. I just don't do it. And I almost always get success on this point, and I get it from just a pull, pull, pull. Ride that chi up, open up the sinuses. Now again, you want to engage with your patient. So once you grasp that chi, you get to that thickness, which could be pretty deep. Sometimes you'll be surprised. You're like, where am I going? Am I falling into a oh, there it is. Grasp and pull. Give it a few seconds, 5 seconds, something like that. Ask them, hey, do you notice that your sinuses are opening up? Often it's unilateral. Well, I should say, often it is bilateral. This point is often bilateral, but what I find is that sometimes, and it's frequent, you will get more on the side that you needle. So you will open this up completely, and you'll open this up a lot. Or sometimes not a lot, or sometimes you'll open this side up completely. But if you're needling on their left side, this will tend to have a greater reaction and greater clearing, and this will tend to be either the same or less, but it has that sort of tendency to it. So it's not uncommon for me to needle this bilaterally. It just depends upon the results I get. I've never seen this be an ipsilateral point though. Well, have I? I don't think so. I think stomach 44, I've seen ipsilateral, where I'll needle the left foot and it opens up the right eye. Watch that video. I don't think I mentioned that in that video, but I think that's the one that sometimes is ipsilateral. I've seen it with some Shaoyang too, where I'll needle Shaoyang channel and I'll get the opposite side, which is sort of fascinating. I've seen that before for sure. Anyway, so you want to go fairly deep. You hit a thickness, you engage the chi there and pull. Now you're not pulling the needle out. You're just pulling, and it's almost like you're holding a rope and you're leaning back. Now you're not going anywhere, but you're leaning and just pull, but you're still pulling on the rope. So it's kind of like that. I mean, your needle will slowly come out a little bit, but it's not like you're lifting and going back down and thrusting and lifting. It's not like that. It's engaging and pull. And then you ask them, how are you feeling? And it is a miraculous point. It will just melt the sinuses. Now they'll get drainage and all that, but they'll be like, oh my God, I can breathe. It's really good. So when the sinuses are congested and clogged, this will open up like a champ. Sometimes, you have to sort of, this goes back to then, strategizing in a situation when the sinuses are clogged. Is it dampness or is it dryness or is it heat? And which one is predominant? If the sinuses are swollen and there's no sort of drippiness, I don't use this point. I might go locally, I'll do other points, I'll do some cooling points. I might switch it up and I might do triple energizer 3 to try to pump fluids into the body, into the upper head, as I mentioned in the other video. So you got to differentiate. This isn't going to work as well on a dry sinus that's swollen. This is going to work really well in damp, drippy sinus. It works really well if there's heat and dampness, but it's just going to clear the dampness. I don't find it clearing heat in the channel the same way as other points I'll use. So I'll use this in conjunction with other points, depending upon the overall constellation of the situation. But what it really shines is when there's a drippy dampness up here. And you just open it up. Now, going back to the story, when I discovered depth, and this is the first time I really discovered depth in an acupuncture point. So I'm needling and I'm clearing this person's sinuses, and I ask them, I say, so how does everything feel? And they say, oh, my sinuses are clear. And something inside me just said, well, ask them if it's all better. I go, well, is it all better? And they say, no, there's still some pressure. Now that's what I mentioned at the beginning of the video, the indication of pressure. What do I mean by pressure? Because pressure could be that dampness deep inside, in which case you want to go really deep. They said, no, it's up here. I say, does it feel very surface, like it's not as deep as it was? And they said, yeah. So what did I just do? I just said, okay, well, let's just take my needle out from the depth, raise it up, and pull again. So I just went to a more superficial level, zoop. And I can't tell you exactly where that is. Just experiment. Pull up to a more superficial level and engage. And all of a sudden, boom, the superficial layer cleared. And I was just like blown. I was like, damn. Holy shit. So, why was my mind blown? Well, in that moment, I did slight adjustments down here based on depth. And that had a ramification on the other end of the channel based on depth. Now, I do this all the time. I practice nowadays, but it was like really mind-blowing at the time, where I can needle at a different depth here and have a different effect over there. And then again, like I mentioned with Triple Energizer 3, Triple Energizer 3 is a little bit more, even more broadly speaking, it goes like all of a sudden you go from deeper in Triple Energizer in your throat, a little more shallow you're in your ear, so it almost like skips an area too. It just takes a different route depending upon the depth. With Stomach 40, what I found is that the deeper hits the internal sinuses, and that the more shallow depth skirts up to here on the surface as opposed to deeper inside. So that was really cool. And so I encourage you, when you're needling Stomach 40 and you're looking at what's happening here, just engage with the patient, find out where the depth is. You know, what is that pain really about? What is that congestion really about? Is it superficial? Is it deep? Clear the deep. Is it superficial there? And this is something, I don't use this a lot. I'll use this in terms of that superficial layer infrequently in my practice, but it's just cool. Like I said, this is a story that happened to me, and so it leaves a kind of a mark in myself. So I'm passing that on to you, not so it marks you and how you use how you use Stomach 40 necessarily, but it's a story of depth. And that story hopefully will encourage you to explore more depth in your needling, where deeper has a different effect than more superficial. And then in triple energizer 3, comparing it to stomach 40, the difference that I have found so far is that triple energizer 3, when I play with the depth, I actually start scooting around the different areas of the body. Here, throat versus ear, different areas. I know ENT, they're very closely related, and that might give me certain advantages. And with stomach 40, what I've seen is it's more about the depth of where it's hitting at the other end of the channel. This could be something too, I might experiment with depth with regard to, do I want to work at a more shallow or more superficial layer for chest pain as well? So I have not explored this, but just kind of musing on depth would be maybe if I feel like it's deeper into the intercostals, maybe I want to do a deeper needling of stomach 40 for that chest pain that you find in this guy. Or if it feels like it's maybe more of the clavicle or something like this up in here, maybe I just want to do a superficial one because I don't bind up there. Really interesting. So utilize depth in your practice, experiment, explore, make acupuncture real in your hands, not just a theory on a chart. And that's why I get really excited and turned on about this point, is because it's a place where you could have a true visceral experience with your needling and your acupuncture, which I think is super important, super important. It takes theory off the shelf and into your hands. Okay, now kind of playing off of that. So I'll treat I'll utilize stomach 40 sometimes for different headaches, especially if it's like pressure headaches. They have a pressure migraine or something like this, or, responds to barometric pressure on opening up the sinuses, yada, yada, things like that. One day I'm needling stomach 40, opening up the headache here. And I say, well, now where's your headache? And they had bad pressure here, and they had bad pain. Their headache was here. And they say, oh, now it's over on the side of my head. Normally what I do is I just skip over to a Xiaoyang and I needle something like maybe gallbladder 37, something like another junction point, just kind of scoot up the channel. You can do other points on the foot, all that sort of stuff, whatever. But I thought, let me try something different. Grab the needle. And I went from stomach 40 and I scooted lateral just a little bit. I wouldn't say I'm really on the Xiaoyang channel. I just was like scooting a little bit lateral. I needled there because I thought, well, if stomach 40 got here, if I go lateral on the meridian, it should move this laterally, right? Stomach 40 got here. If I move this a little bit here, I'll move this a little bit here. And wouldn't you know, got it. Boom! Opened up this area of the head. Now, I happened to be explaining this to one of my friends who's down in North Carolina. And he said, oh, well, Todd, he does a lot of Master Dung work. He said, oh, Todd, that's a Master Dung point for Xiaoyang headaches. So I thought it was pretty cool. So I sort of stumbled upon this. Now, there's a couple ways you can look at this. You could say, well, Todd, you just stumbled upon a new acupuncture point, blah, 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 or an old acupuncture point, this one, for Xiaoyang headaches. Yeah. You could say that. But if you say that, it puts you into the mind frame of a digital space. And a digital space goes back to that acupuncture chart where I want to rail and just tear off the wall and burn. Because it puts you in a place where you're looking at the channel as a little teeny itty bitty line. And this channel is a little itty bitty line. And it takes it away from the reality of width, of depth, of a perceived engagement with the actual viscera, the actual flesh, the actual channel that's alive in the person. So I tend to shy away from the digital, yes, no, Yang Ming, Xiaoyang, and I'm looking at that as a moment of expanding my mind and not saying, oh, there's just another acupuncture point there, but of expanding my mind and saying, well, I can play the strings of a channel. And if I play them here, they're going to hit there. If I play them here, they're going to hit there a little bit. And maybe if I play them a little bit further over here, we're going to enter into an area where they go somewhere else. And then we call that another trajectory. So I'm constantly trying to get a more firsthand experience of my acupuncture and trying to fit it in and understand it not from an isolated 1.1 channel perspective to a little bit more of, I'm working with actual tissues of the body. I'm working with the fibers, the tissues, the vitality of another human being. And when you look at it from that perspective, it can open up and it can bring it into a more an alive state, and it allows you to play. It allows you to go off the map a little bit, off that road, and you can see what's down there. And Stomach 40 was an invitation for me to explore that, explore it with depth, explore it with width, and see that, oh, I can play that. And when I look at it like that, then what happens is I can begin to understand, well, maybe how the leg relates all the way up. And then it's not just about a channel. It's not just about a point, but it's about engaging with a real life human being. And that's why I think it's important to kind of break out of a digital this or that and put it a little bit more into an analog of a flow, kind of a movement through the body. So it's not that we have 12 channels and all these secondary channels, but know that we have this sort of interwoven life that we're working with. You know, I don't want to say energy, I don't want to say chi, I don't want to say blood. I mean, it is some sort of chi and blood, and sure, it is some sort of energy or something like that. And I don't really want to say fascia, I don't really want to say muscles, and I don't really want to say sinews. I mean, sinews sort of is the best one, but I don't, and I don't want to say blood vessels exactly, but it's like all of these things combined is what you're working with on a human being. It's not just a line on a freaking chart. That's depth, has width, has vitality. And that's the important part here. Because if you get that more firmly, if you get that in your hand, then it opens up all sorts of passageways, all sorts of roads, all sorts of ways of exploring acupuncture with your patients in real life. And that's going to be the end of this. So, in this video, we looked at some general indications. I encouraged you highly to run out and get Lorraine Wilcox's translation of Zhenju Zishenjing, if I said that correctly. Read your Ling Shu chapter 10. It's awesome. And then we looked at general applications, specifically what do I use this for? Congestion, damp, phlegm in here, pressure. We looked at depth in that regard. Also, Shaoyang headaches, the side of the head, and we looked at the width of a channel and playing with the width of the channel as well. And we looked at needling, depth of needling, kind of the angle, things like this. I hope this is helpful for you. I know these are long videos, but just what I enjoy. In this whole coronavirus thing, stay safe, be well, and then look out for my next video, which I believe is going to be Stomach 32, which is going to be super cool. And in that video, we're going to get into a lot of sinew work as well. So we'll look at Stomach 32 from a digestive perspective, but also from a sinew perspective. All right. Well, be safe. Have a good time.